All right, well, first of all, it is so nice to be here face to face and not through a screen. So this talk is very informal, and feel free to stop at any time and ask me questions, okay? Thank you. My wife says I always talk too loud, that's why I put it away. Any husbands agree with me on that one? Yeah? I'm not the only one. All right, let's see if I can make this go. No, we love all the ladies too. Let's see. This is all in German, how to advance this, I'm not sure. Let's try. First one? There we go, okay. So before I forget, I want to send best wishes from my wife and son, Susan and Stefan, who really wish they could be here. I think they're in bed now. So this story for me started back in my training. And actually the first Jacobsen syndrome patient I saw was in July of 1995. So my original goal has been to try to identify genes that cause something called hypoplastic left heart syndrome. It is one of the most severe congenital heart defects. And the idea is to try to understand at the cellular and molecular level this disease. So we could hopefully improve our therapies and even maybe someday prevent this terrible heart defect. So in July 1995 was when I came across my first patient with Jacobsen syndrome. And he had a form of this heart defect that I'll just call HLHS, hypoplastic left heart syndrome. And knowing that he was missing a part of chromosome 11, we hypothesized that there must be a gene there that was the cause. That would be interesting to study. And over the years, we learned that actually Jacobsen syndrome has one of the highest frequencies of hypoplastic left heart syndrome. Maybe about 5 to 10% of all babies with Jacobsen syndrome have hypoplastic left heart syndrome. And that's probably higher than any other known genetic syndrome. And the hope is that what we learn from Jacobsen syndrome will not only help people with Jacobsen syndrome, but also the general population of people that are born with this heart defect. In the United States, there are about 1,000 to 2,000 babies born every year with hypoplastic left heart syndrome. So I just, on a very personal way, want to share with you some of my experiences. Which over 25 years is hard to pack into 30 minutes. So these are just a few of my thoughts. So back in about 1997 was when I reached out to the support groups. And in the United States, there had been another researcher that was working on Jacobsen syndrome. But he made a lot of promises to the group that he could never keep. In English, we would say he was a bullshitter. So understandably, the group had a lot of distrust or didn't trust maybe what my goals were. So hopefully after 25 years, I've proven to them I'm not a bullshitter. All right, so another challenge was I knew nothing about this syndrome in the beginning. And so kind of following the model of the European group, we decided to have conferences every 2 years in San Diego. And that really gave me an incredible opportunity to meet families, to listen, and to learn a lot about Jacobsen syndrome. Which continues to this day, and I'll be meeting with probably most of you in the next few days as well. And as you can imagine, the greatest part has been the friendships and bonds that we have formed together over the years. And I could go on and on about so many wonderful stories and relationships. But maybe I should save that for the beer sessions in the evening. Another challenge, as I talked to the families, was to help to learn not just about the heart problems, but all the other problems in Jacobsen syndrome. So over the years, I assembled a group of experts from all over the world to pursue that knowledge. And back in about 2004, we published our first major paper on 110 cases. Before that, the largest number of patients described was 17. So that was a really nice start. And obviously, one of the biggest challenges was, first of all, to figure out, because we knew there were children that were dying. So we wanted to figure out what the causes are and why. So these are the three historically most common causes of death. So bleeding, including brain hemorrhages, infection, and congenital heart disease. And we developed what we call, with the help of a wonderful lawyer from the United States, medical protocols. That are actually medical legal documents that you give to your treating doctors. And I think these have gone a long way to decrease the number of deaths from bleeding and infections. So today, probably the most common cause of death in some children with Jacobsen syndrome is congenital heart disease. So that means I've still got a lot of work to do. So this is back in July of 1995, the first boy I took care of with Jacobsen syndrome. And I still take care of him now. So one of the things we needed to do was to figure out what the genes are that are affected by the deletion. And this is a technology that came along in the late 2000s that's allowed us to do that. There are different names for it. Sometimes it's called microarray or chip. And this technology will allow us to get a readout of exactly what genes your child is missing or maybe duplicated. And this has had a huge impact then on our ability to identify specific disease-causing genes. And knowing whether or not a specific gene is missing allows us to predict some clinical outcomes. And lead to some of those life-saving measures. So this is a little girl that I met early on. Her name was Sasha. She was born with hypoplastic left heart syndrome. And as a baby, actually got a heart transplant. And she actually had a very relatively small deletion that helped us to narrow down where we thought that heart gene is on 11. And very sadly, she passed away one day when she was out riding her bicycle from complications from her heart transplant. These are two siblings, a brother and a sister from England, who both have the same deletion, but they have very different heart defects. I think you can see her here, she has kind of a bluish appearance, whereas he has normal color. So we're beginning to learn why, even with the same deletion, two children can be so different. Some of you may have known Julie Ziegler from Denmark. She was also born with a heart defect. And very sadly, several years ago, passed away from an infection of her heart called endocarditis. And we didn't appreciate back then that she probably had immunodeficiency. This is a little baby from New York who was also born with hypoplastic left heart syndrome. And she had a very unusual type of chromosomal defect that allowed us to actually pinpoint the heart gene, which is called ETS1. Can we turn down the lights just for a minute? Is that possible? Because this is kind of a cool slide. Is that possible? Okay, so what you see here are the chromosomes taken from her blood. This is a normal chromosome 11 that I'm showing you here. This red dot marks the center of the chromosome. And these two little red dots mark the end of chromosome 11. Here is her other abnormal copy of chromosome 11. So you still see that dot in the middle and the two dots at the end, but you also see some extra dots right here. And those extra dots actually helped us to pinpoint the heart gene. So as you can see, these few patients were extremely informative to help us to identify this gene. So tomorrow I'll be giving a very detailed talk about what this gene does in heart development. And how we think the loss of this gene can cause some of the heart defects that some of your children have. So the good news is, over the years, we've become much better at taking care of children with Jacobsen syndrome and heart defects. So this is a little boy I take care of in San Diego who has Jacobsen syndrome and hypoplastic left heart syndrome. And he's gone through now multiple heart surgeries, and you can see is doing very well. And this is very important because to this day, I get emails from around the world from families who have a baby with Jacobsen syndrome and hypoplastic left heart syndrome who tell me their doctors don't want to touch this baby because they're afraid. So a couple years ago, we actually published a paper about this boy, hopefully showing the world that, in fact, even with Jacobsen syndrome and hypoplastic left heart syndrome, you can do well. But it's not easy. This is the first baby, actually, that I diagnosed with hypoplastic left heart syndrome. In July of 1996. And she does not have Jacobsen syndrome. We don't even know what the cause was in her case. So here she is now, 26 years old, beautiful and smart. But her future is actually very uncertain because of this disease. So how can we use our knowledge to help people like her, Madison? We don't know yet for her case because we don't even know what the genetic cause was in her. But this is a case of two children, brother and sister, and their mother, who were all born with different heart defects, including her with hypoplastic left heart syndrome. And we found that they have a mutation in a gene that works with ETS1, And because we know the function of that other gene called Tin Man, we knew that over time their electrical system of their heart will die off. So with that information, we put pacemakers in the two children and the mother. And those have been truly life-saving measures, only because we knew about the genetic cause. So our research actually uses a lot of different animal model systems. Including something called the fruit fly, like what you see in your kitchen. And this has allowed us to identify a network of genes that regulate other genes. This is actually the fruit fly version of the ETS1 gene called pointed. And these same genes are in the fruit fly genome that are also known to cause hypoplastic left heart syndrome in humans. And based on previous studies on these genes, that allows us recently to identify a new gene called even skip as a new cause of hypoplastic left heart syndrome. So we're currently studying how these genes function in normal heart development and how the loss of these genes can lead to heart defects, including hypoplastic left heart syndrome. And I'll go into much more detail about that tomorrow. So early on, many families approached me about their concerns about behavioral and cognitive problems. And so I was able to assemble a team of behavioral experts in San Diego that over the last 10 to 15 years did a lot of very robust evaluations of children like yours. And we've published several papers, including identifying specific genes that cause these problems. And at least in one case, there may be a therapy based on the function of one of these genes, maybe. Some of you may know this family, the Olney family. This is Robin, who I first met here many years ago. And I was very shocked when her mom told me that Robin was actually diagnosed with autism. I was very shocked because most of your children with Jacobsen syndrome seem very friendly and outgoing. So that was very surprising. So this is one of the papers that we published in 2009. Characterizing some of these behavioral and cognitive problems. including identifying at least 2 genes that we think are responsible. BSX1 is very important because only those with the bigger deletions are missing 1 copy of this gene. And we think it is this gene that is the cause of much more significant intellectual disability. And so in 2014, with Drs. Aksumoff and Matson, we published our paper showing evidence for autism. And identified what we think is the gene, 1 gene that's responsible. Although in Jacobsen syndrome, there are probably multiple genes that can cause autism. And the 1 gene that we identified is just one of those. But unfortunately, my colleagues are nearing retirement age now, and they're not going to be doing any further research in this area. We have tried treating just a couple of patients with a gene-based therapy, but it's very hard to know what to conclude. And looking forward to do this properly, we need to do a prospective, double-blinded crossover study. That's a mouthful. All right, so Ken, that most of you hopefully know by now, became part of our family back in about 2012. And it was at that time when Ken knew how to ask the right questions to the families. And after about a 30-minute talk became a 2-hour talk with questions, we began to appreciate just how common immunodeficiency is in Jacobsen syndrome. So Ken will talk to you much more about that formally and in your one-on-one meetings. And shortly after that, many of you probably know Virgil Dam from Holland, who has joined with us as well to help us to understand the immunodeficiency problems in Jacobsen syndrome. I think you know where this picture was taken, right out there. But truly, Ken and Virgil have worked together to come up with truly life-saving therapies, and I can tell you from my own experience, because of their knowledge and dedication, children that used to get infected frequently are now basically infection-free thanks to the therapies that Ken and Virgil have recommended. And I hope they will publish these results. So I was originally asked to share my reflections about COVID. Ken will be talking about that in the next talk. But already, with their guidance, we've come up with some guidelines for treatment. As well as recommendations for your children for vaccination. and frequently helping us to recommend when it's safe for your children to be back in school. So again, Ken will be going over all of that in the next hour. So another challenge for me has been getting the money to keep my lab going. So UCSD graciously gives me actually space for my lab. But they don't give me any money to actually pay the bills, including the salaries of my researchers and all the other reagents and expenses. And that comes out to about $250,000 a year. So I have been extremely fortunate to have many people, like many of you in this room, including, for those of you that know Craig and Rebecca Thomas, who, when I first met Craig, I had never heard of a show called How I Met Your Mother. And of course, I learned that Craig and his colleague Carter Bays were the creators of this television show. Just out of curiosity, how many of you know about this TV show? Yeah, it's amazingly popular. For those of you that have been to Berlin, there's a bar there that was the basis for a big part of that show. So Craig and Rebecca, while the show is running, organized 2 fundraising events on the set in Hollywood, in Los Angeles. So each of those in one night raised about $150,000. And even since the show finished about, I think, 4 or 5 years ago, Craig and Rebecca have worked tirelessly to continue to help support our research. And if any of you are interested in the conference in the United States this summer, in Washington, D.C., so it's an easy trip for you guys, right? Craig and Rebecca will be there with their son Elliot and their daughter Celia. But if you do the math, even the great work that Craig and Rebecca have done is not enough. And so this is a partial list of all the different sources of funding that I've been able to secure. From some conventional sources like the National Institutes of Health, and the American Heart Association, and also through many other smaller foundations that are dedicated to supporting research on congenital heart disease. And many of you in this room and really throughout the world have been truly heroic to support my work. And I truly can't thank those of you that have worked so hard to help support that. It wouldn't be possible without you. It's that simple. So one of the challenges with all this information is how to spread it accurately to all of you. The internet is a great tool, but can also be misused. So very recently, we've added a couple new sections to the American support group. So one section, especially for new families, is called Frequently Asked Questions. And the other section is a list of all of the papers that have been published on Jacobsen syndrome since the original case report in 1973 by Dr. Jacobsen. I believe there's something like 130 papers now in this list. And there's a whole variety, basically all of the areas relevant in Jacobsen syndrome. And with one click, you can download these papers for yourselves and all of your treating physicians. And that's thanks to this young lady who is currently a pre-med student. Elena Chavez, who approached me about doing some kind of a clinical related project. And she has promised that she will continue to update the database on a regular basis. So I wanted to save the most difficult challenge for the last one. I think most of you knew Noah and Vanessa, who we lost since our last conference. And we will always honor their memory and their legacy. And Rick, to have, where are you? To have your family here is really incredibly moving, so thank you. All right, so just to finish, in the future, we will continue with our heart research. And we envision that it will allow us to personalize care to each patient. And as I'll talk to you tomorrow, we even have the potential for being able to prevent hypoplastic left heart syndrome. For the behavioral and cognitive problems, as I mentioned, my colleagues in San Diego are stepping back. But we know there's a group in Spain working very closely with the Spain group that is actively pursuing this area as well. So I look forward to hearing and learning more from their work in the future. You're going to hear from Ken, and I'm sure on behalf of Virgil and his colleague who is here, I believe, about COVID and the future for vaccines. And another interesting topic that comes up every so often is how long can people with Jacobsen syndrome live for? And now that we have hopefully eliminated two of the most common causes of death, I'm sure in the future we will learn much more as your children grow older. And for those of you that know Teresa Mattina from Catania, she has a lot of information already, and I hope she will be able to publish to help answer this question. And as I just mentioned, I think the internet is an incredibly powerful tool. to help with communication and support. And lastly, funding is always a challenge. So I always am humbled by my cat, in this case, Oliver. There's always more to learn. And I wanted to finish with these last two slides. For those of you that don't know, Alan Alda is a very, very famous actor in the United States. Best known for a TV series from a long time ago called MASH. One of my favorites. And more recently, because of his layman's interest in science and medicine, he founded something called the Center for Communicating Science. And I was very fortunate to hear him give a talk in San Diego a few years ago. And this is, I think, one of the most powerful statements that he made in that talk. I'll just read it in English and the translators can do their thing. So, real listening is a willingness to let the other person change you. When I'm willing to let them change me, something happens between us that's more interesting than just a pair of dueling monologues. And finally, for those of you that have ever followed American college sports, John Wooden is arguably the greatest college sports coach of all time in the history of the United States. And he was known not only for just his wins, but for the character and success of his players off of the basketball court. And I love this quote. Make each day your masterpiece. And I'll share one more quote of his that I heard actually recently. When somebody asked him after the conclusion of a basketball season if he thought that was his best team that he'd ever coached, here was his answer. He said, "Come back in 10 years and ask me that same question, and then I'll know after I know what they've done off of the basketball court." And that's the end. Thank you. I would be happy if people have any questions. Or I think we probably finished a little early if there aren't any questions. Are there any people on the internet that have questions? Go ahead. Yeah, so the people on the internet can hear, yeah.
On? Yes, it's on actually. Actually, I had two questions. Thanks a lot for your presentation. It's the first time that we joined the conference this year. Our daughter is 3 years old, so last time
right.
she was just born. I actually had two questions. One is, you said something about gene-based therapies.
Right.
What is that?
Yeah. So one of the genes that we found has been studied by a group from Tokyo. And in their studies, once they worked out the mechanism, how this gene works, they showed in mice missing this gene that a single dose of a commonly used drug called clonazepam helped with the autistic features of these mice. So we have actually treated a couple, I think 2 or 3 patients now with a mutation in this gene or Jacobsen syndrome with autism. And it looks like there, in some but not all, there can be some improvement. But it seems like the improvement is short term, and that over time, the patients develop what we call tolerance to the drug. So that's as much as I can tell you. I'm not, at this point, recommending necessarily to try treating your child with clonazepam. However, in one child that had very, very aggressive, impulsive behaviors, we did try him on clonazepam, and at least for some period of time, that seemed to help with those aggressive behaviors. So in a rare case like that, we would call that an off-label treatment. But we really don't have enough answers to know if it's a good long-term solution.
I wasn't actually asking the question specifically for our daughter. I was just interested to see what the perspectives or in the future could be with regard to any gene-based disease and these kind of therapies, but specifically for Jacobsen, of course.
Right. So the question is, what is the potential for any specific gene-based treatment, correct? So, for example, for your children with Jacobsen syndrome, we really can't go back and fix the chromosome, even if we could. It's kind of too late, right? But what we might be able to do, like the example I just told you, is as we understand what each gene does, we might be able to find therapies to replace the function of that missing gene. And that was the rationale for clonazepam, as one example. But in order to get there, it really requires hard research to identify the gene, to understand what the gene's functions are, and then to test potential new therapies. Does that answer the question?
Yes.
Did you have a second question?
Yeah, coming to my second question,
Yeah.
yes. You mentioned something about life expectancy and hopefully getting something published, or at least by a colleague,
Yeah.
on that topic. And I see a lot of young children with Jacobsen here, and
Yeah.
I've heard some of the others that aren't present, age 20, 25.
Mm-hmm.
But do you know many people with Jacobsen that have reached 40 or 50 or 60?
Yeah, so the question is, who are the oldest living people with Jacobsen syndrome, basically, correct? Yeah. So the original patient, who is from Copenhagen, described by Dr. Jacobsen in 1973, is now about, I think, 63, 64 years old, and lives in a group home, I think, in Copenhagen, and last I heard is doing pretty well. So in theory, if you prevent infections, if you prevent bleeding, and hopefully if you're not born with a terrible heart defect, it's possible that people with Jacobsen syndrome may live a normal life expectancy. But That remains to be seen. We still don't know enough to say that with great confidence. But there are definitely people around in their 40s, 50s with Jacobsen syndrome. Even, I think I heard a story of somebody in their 70s somewhere. But people that are in their 70s were not getting diagnosed 70 years ago because we didn't have the technologies. So there are probably people out there.
I think you could, even though it was only discovered, so to say, in the 70s.
Yeah.
People that are 40 or 50 or were 40 or 50 in the 70s, you could even find out today, they're still alive, of course, that they have Jacobsen, because the test isn't that.
Yeah, you can always
right?
test people. Yeah. Yeah.
That was it for me.
Okay. Any other questions? Thank you.
Cool. Thanks a lot. Two questions just out of curiosity. You mentioned genes that were working with ETS1 for the heart whole development.
Yeah.
Are there on other chromosomes?
Yes, those are other genes on other chromosomes that work together, what we call a transcription complex. So it's a group of proteins that bind together to regulate the expression of other genes. I'll talk about that more tomorrow, but yeah.
And regarding the cognitive issues, you mentioned BSX1.
Yeah.
And another gene called neurogranin.
Yeah.
It's also on the Q arm of chromosome
Yes.
11. Where is it located compared to BSX1, like lower or?
It's closer to the end of the chromosome.
Like the end?
To
okay.
the end.
Yeah, okay.
I want to say it's about, well, that's not very accurate. It's about, so if you look at BSX1 is about exactly 12 million base pairs up from the end, 12 megabases. Neurogranin, I think, is about 10 and a half. I could give you the exact numbers.
Okay.
About 10 and a half million base pairs up from the end. Okay. So it's closer to the end. So if your child has a small deletion, they're not missing either of those genes. If they have what I call a medium-sized deletion, they're missing neurogranin, but not missing BSX1.
That's Margot's case. Yes.
And I can tell you, if you give me, I can look back for you. But if they have a large deletion, more than 12 megabases, then they're also missing the BSX1 gene.
Thanks. Last question, because I didn't get the whole story. How did you get to meet the cast of How I Met Your Mother, and how did you get them motivated to fundraise for us?
Right. So the question is, how did I get connected with How I Met Your Mother? So Craig and Rebecca reached out to me shortly after their son was born, about 15 years ago. At that time, they were living in Los Angeles. So within about a week, they learned that their child had a complex congenital heart defect that required open heart surgery. And then just literally a few days after that, they learned that their child also has Jacobsen syndrome. So as you can imagine, that was a devastating amount of news to new parents who didn't expect any of that before. So they had a friend who was very internet savvy who found my name on the internet, and they reached out to me. Like I said, this is honest to God truth. I had never heard of How I Met Your Mother. I had no idea what that was. So they came down and spent a whole afternoon with me in San Diego with their baby, Elliot, asking me everything they wanted to try to learn about Jacobsen syndrome. So that was 2007, April or May of 2007. And then over time, I helped them, obviously, because there was so much unknown until they met with me. So, you know, the support, right, to spread knowledge. And that was very meaningful to them. And then sometime Craig, who is very, very modest, told me, he writes stories or something, but that's when I then learned about How I Met Your Mother. And they really wanted to do something to give back, not just to me, but to help all the families, which to this day they continue to do, which is amazing. They're incredibly gracious people and love to give back, and we have a great friendship. They're like family, and I know that they send everybody here their best wishes. Does that answer the question?
Yes,
Yeah.
thanks.
Like I said, I could spend hours just talking about all these wonderful personal stories.
Ja, hallo, ich wollte fragen, bei meinen beiden Kindern MRT-Befund auffällig.
I better get my earphones. Hang on. Okay. Go ahead. Oh, you're going to translate. Oh, okay, thank you. Okay, fine.
So the question is, both her children have Jacobsen syndrome, and
You said both?
both,
Oh.
yes. And for both children, the MRT, the MRT results were really they were really there was the same, and there were do you think that all Jacobsen syndrome children have strange or special MRT results?
Special, I'm sorry, I don't understand. What kind of results? Oh, MRI. Of the brain?
It's a partial deletion, and
The question is if all Jacobsen syndrome children have a different brain
Findings?
yeah, and to relate it to other children.
Okay, did everybody get that? So the question is, are there any, let's say, specific findings of the structure of the brain in people with Jacobsen syndrome? I'm not the best person to answer that question. I know that Teresa Mattina has been studying that and collecting MRI studies from a number of people with Jacobsen syndrome to try to look for patterns that may not be so obvious if you just look at one person. So far, I'm not aware of any unique or specific findings really in Jacobsen syndrome. But there was one paper, maybe two papers, a couple years ago that described one type of finding in a patient called leukodystrophy. And that is a disease in which the covering of the nerves, the white matter in the brain, is abnormal. And that is a degenerative kind of disease over time. But fortunately, I only know of maybe one or two cases. I don't think that affects most people. So hopefully in the future, Teresa Mattina will give us more information to answer that question. Does that help? Yeah. Any other questions? Yes.
Because you're a researcher and we've got the cases, children. How can we help you, provide you with data? Do you want to reach out to us, or can we provide you with the data you need for your research on our behalf?
Thank you. So the question is, how can you families help me with my research? I think, just these kind of interactions, whether it's face-to-face or by the internet, are really extremely helpful to me. For example, up until maybe 5 years ago, I knew of maybe one or two cases of a brain hemorrhage. And then over a period of about 2 years, it was Nigel Barrett who told me about Vanessa Ivan, I think, and several others. So all of a sudden, we knew of like 7 cases of brain hemorrhages. And so it's that kind of ongoing communication, I think, that really helps us to learn more what the problems are. And in that case, getting a type of MRI called an MR angiogram can help potentially identify people that are at risk for a brain hemorrhage. So that's an easy solution to a problem that we didn't even know about until pretty recently. As far as the heart research, I'm good with that because it's been extremely helpful, and now it's on me to keep going with the research. Of course, there may be new situations that I'm not aware of, and that's really important. But I think the most important thing is just this kind of ongoing communication.
I'll just, this is Ken. So I'm going to just add a little bit to what Paul mentioned about how important these conferences are for people that are maybe not attending today or couldn't attend, because we had the same experience in regards to the immunologic problems in kids with Jacobsen, that until Virgil and I started participating in these meetings, people didn't realize how common some of the infections actually were, and that some types of infections were never even discussed. For example, the warts that people see very commonly in children with Jacobsen syndrome. And that has led to Virgil doing a lot of work regarding the immune deficiency problems in kids with Jacobsen syndrome. So sometimes it's just the casual conversations that we have after a scientific lecture like this that brings things to the surface so that everyone, especially the researchers like Paul and Virgil, a little bit of myself, can then go back home to try to think about. So these conferences are invaluable. And the communication even between conferences when people email us or discuss amongst themselves. So I think that's a very important part of what the group here can do, is to continue having these types of collaborations.
Absolutely. And like I said, for us researchers and physicians to be really good listeners, my wife would be shocked for me to say that. She doesn't think I listen to her at all, but it's true. That's not true. What other questions? Yeah. Then
So,
hang on to that. Go ahead.
as we heard, you talk more about megabases, and when we got the diagnosis of Amelie, we just got the diagnosis with the genes. And what is now exactly what I have to ask the genetic specialist in behalf of the megabase?
Okay, so the question is, like when you get the report, typically
Yes.
nowadays, it's not going to be 23.3
Yeah.
or 24.1. It's going to be 11.6 megabases. That's the kind of report you're going to get. And that is a huge step forward because that literally gives us the details to know exactly which genes are deleted. And then I can tell you if it's your child, let's say if they're missing a gene called FLY1, that's the gene that causes the bleeding problems. So they're prone to bleeding. If they're not missing FLY1, they're probably not prone to bleeding. So I always ask people to send me the report, and I can go over with you individually, either at the conference now or by email, what genes are missing that could have clinical implications.
And the question to it, do you think she already knows the megabase, or do we have to do it again?
When was she tested? How long
It
ago?
was 7 years ago.
Probably they did the array back then.
Mm-hmm.
People have been doing the array diagnosing now for a good 10 to 15 years now. So why don't you, if you can find me the report, I'll tell you in a minute if it's probably an array, which would be very helpful. Yeah. Go ahead. Yeah.
Als eerste, Paul, dank je wel voor Paul, dank je wel. 25 jaar, wij lopen vanaf 1997 ook mee. 1998 voor het eerst in Ede hebben we elkaar toen ontmoet.
Ja.
Esmee is inmiddels 25. Ik sluit graag even aan bij de vraag van mijn voorgangster. Is het voor ons dan ook interessant om nog meer te weten, behalve dat Esmee een deletie 23 punt zoveel heeft?
So it would be certainly helpful to do the array to know exactly what genes are affected. But, you know, she's 25. You probably know she doesn't have a heart defect or did, you know. Sorry. Yeah. So the question is, even though their daughter is 25 years old now, would it still be useful for her to get the array test done? And I think it can be, but there probably won't be a lot of surprises by now because you already know what her problems have been. But it still could be helpful.
We hebben in het verleden ook een keer bloed afgestaan.
What a stud.
In het verleden hebben we hier in Duitsland ook een keer bloed af laten tappen, zo gezegd. Dat is volgens mij ook al meer dan 10 jaar geleden. Is daar dan ook nu nog weer een nieuwere rapportage van gemaakt? Of wordt dat bijgehouden?
Do you remember who took the blood sample? Hang on.
Ja. Dat was voor jou.
I did. Well, let me look back and see what I have. Okay? Are we meeting? Because then I'll have
Dan
it
maken we
on
een
my
afspraak.
computer.
We make an appointment.
Yeah. But even if it was 10 years ago, the tests today are probably better quality than what we did, 10 years ago.
Dan heb ik nog een andere vraag. Misschien is dat te specifiek, maar ik ben dan wel eigenlijk altijd benieuwd als je zo'n chromosoom hebt. Is de volgorde van de genen dan op het chromosoom 11 bij iedereen hetzelfde?
So the question is the order of genes the same for every person for any chromosome? In general, the answer is yes, for the most part.
En dan noem je soms dat dus een kleine deletie. Vanaf welk punt noem je het een kleine deletie?
Right, so I've kind of come up with my own way of describing the size, so small, medium, and large.
Oké.
Okay?
Ja, thank you.
Any other questions? Okay. Do we want to take a break for a few minutes before Ken? Yeah, why don't we do that? All right. Thanks, everybody.